Okay. Sorry guys, I was having a little bit of a technical issue here on my end, but I think that I have fixed the problem. So hopefully everybody who's tuning in can see and hear me fine. My name is Nicole Kepke. I'm a nurse practitioner and the Pediatric Emergency Care Special Interest Group Chair for NAPNAP. I have 20 years of experience as an emergency department nurse practitioner, and I'm currently working as an innovation specialist at the Children's Hospital of Philadelphia in their primary care network. Over the next 30 minutes, I'd like to explore issues surrounding firearm violence prevention and firearm safety, confronting both pediatric providers and the families we care for. If you have any questions or comments, please feel free to drop them in the chat and I will address them at the end. People throughout the country were wearing orange this weekend, as I am tonight, to raise awareness of issues surrounding gun violence in the United States. The Wear Orange movement started in honor of Hadiah Pendleton, a 15-year-old from Chicago's South Side who was shot on January 13th, 2013. Pendleton was slain just days after performing at President Barack Obama's 2012 inauguration, and her death made the national news. In the wake of Pendleton's death, on what would have been her 18th birthday, her friends wore orange to remember her and to raise awareness about gun violence. Wear Orange is the first Friday in June and has grown to become a National Gun Violence Awareness Day. Orange is symbolic, since this is the color hunters wear to signal to other hunters not to shoot. This was the 10th anniversary of Wear Orange. It was also just the 10th anniversary of another tragedy that captured national attention and still lives on in the hearts and minds of many as symbolic of this country's complete failure to protect its most vulnerable citizens. On December 14th, 2012, a lone gunman with an assault rifle killed 20 first graders and 6 educators at the Sandy Hook Elementary School. I will never forget this day. I was working in the emergency department at the Children's Hospital of Philadelphia, and even though CHOP is a long way away from Newtown, Connecticut, we still got the call that there was a mass casualty disaster at an elementary school and that they may need to transfer patients to pediatric trauma centers across the East Coast. I remember the agonizing wait, thinking about my own daughter who I had dropped off in her own first grade classroom that morning, waiting at the ready to jump into action at a moment's notice, for the opportunity, that slim chance to save lives, waiting for a chance that never came. I had done that agonizing wait many times before that day, and sadly I've had to do it many times since. As healthcare providers in the emergency department, this is part of the territory. That was the first time the thought that this could be me penetrated the armor I had painstakingly built over my then 10 years in the emergency department. As healthcare providers, we all wear armor to protect ourselves from the painful nature of the work we're asked to do every day. This is a necessary part of the uniform and allows us to focus on the task at hand and be able to get the job done. That doesn't mean that we don't care or that these experiences do not impact us. I can only speak for myself here, but I carry these patients and their stories with me every day of my life. I remember after Sandy Hook, our collective cry of never again, as the nation stood and looked on in horror at the events that had transpired that day. But the more things change, the more they stay the same, and that same scenario has been played out over and over again. Almost 10 years later, on May 24th, 2022, another 19 students and 2 teachers were killed at the Robb Elementary School in Uvalde, Texas, and 17 others were injured but survived. I bring up these anniversaries not only to share why this work is so important to me, but why it is of such critical importance to all of us. The toll of gun violence does not just impact the healthcare providers at the bedside or the immediate family. It has a ripple effect that rips through the entire community. It takes a toll on each and every one of us. Did you know that every person living in the United States loses 103 days of life expectancy to gun violence? That's almost 3.5 months. If you were facing end-of-life decisions, what wouldn't you give to live another 3.5 months? And yet we haven't managed to make much headway on this critical public health crisis. And we know that this burden is not evenly shared by us all. Race matters. For Black men, that number skyrockets to 351 days, almost a full year of life. Black boys are 18 times more likely to die by firearm violence than their white peers. Black girls are at far less risk than their male counterparts, but are still 4 times more likely to die by a firearm. How many of us have lost a friend or family member to firearm violence? Depending on who you are and where you live, that number is going to vary greatly. I grew up in rural Wisconsin, and while I knew several people who died in car accidents, especially related to drinking and driving, I did not know anyone who died as the result of firearm violence. My daughter is a different story. She's adopted. She's a 16-year-old African-American girl living in urban Philadelphia, and she has lost 11 of her friends to firearm violence in the last 3 years. Every day she has to worry about her brother, who is at 18 times greater risk of death every time he leaves the house. Every day she has to wonder who's next, where is next. Even places that were once considered to be safe havens for children, like schools and churches, are no longer safe. These are burdens that no child should ever have to bear, and she's not alone. Just a few months ago in Roxborough, a neighborhood in the northwest part of Philadelphia, a simple football scrimmage erupted into violence, resulting in 4 players being shot and the death of a 14-year-old boy. It isn't even the horror of mass casualty events like Sandy Hook and Uvalde that take the biggest toll. It is these everyday events, the violence that happens day in and day out, that gradually erodes our sense of safety and well-being. As pediatric providers, I'm sure we have all seen children come into the hospital or clinic with mental health-related symptoms, including depression, anxiety, and symptoms of post-traumatic stress disorder in the days and weeks following a shooting near their home or school. Children like my daughter do not have the emotional armor of a seasoned emergency department nurse practitioner built up over 20 years of practicing at the bedside. Symptoms of mental health distress in children can appear within days of hearing about a shooting, even when they were not directly impacted or involved. Children who are witness to shootings repeatedly and frequently are at particular risk of developing mental health symptoms. In the past, many violence prevention advocates have used firearm violence numbers as weapons against firearm owners. This has proven to be an extremely ineffective strategy. Parents need our help in understanding the things that we do know and are unquestionably expert in, namely what young brains know and don't know, and what children are developmentally capable of at different ages and stages. As experts in child health and development, we need to ask the question about firearm access so we can focus the discussion on safety. Americans have diverse reasons for owning a firearm and diverse beliefs about the risks of such ownership, yet they all agree that they want to keep their children safe. It may seem ridiculous to be talking about firearm injury prevention in a prenatal or newborn visit. Obviously, newborns are not handling loaded and unlocked firearms in the home. Their risk is entirely dependent on those around them. They can still be the victim of an intentional or unintentional shooting, and domestic violence is probably their highest risk, but this is still very uncommon. The newborn period is still a great time to begin talking about firearm safety. Since this is the first time you're going to be meeting with a family, it is the perfect time to begin acclimating them to conversations about firearms in the home. Establishing firearm safety counseling as a regular part of the Well Child Check will go a long way toward desensitizing the topic and making it an expected part of the visit. Research suggests that discussion of firearm safety and safe storage, even in the newborn period, can result in significant increase in safe storage practices. Accidental shootings in the U.S. are a huge problem. According to the research conducted by Everytown for Gun Safety, there were 392 accidental shootings committed by children in 2021. 163 of those shooting incidents resulted in death. There were 248 non-fatal injuries. Since as early as 2012, the AAP has recommended universal screening for firearm access and firearm safety counseling at every pediatric visit. 75% of parents, regardless of their firearm ownership, agree that there should be universal screening for firearms at all child health encounters. Both firearm owners and non-owners acknowledge that they are especially open to discussions about firearm access and safety with their pediatric provider. 90% of pediatricians agree that they should ask about the presence of firearms in the home, and 96% agree that they should discuss safe storage practices as part of the screening process. Parents who receive physician counseling are more likely to adopt safe storage practices, and it's also important to educate parents that a child as young as 3 years old has the strength to pull the trigger of a handgun. In the toddler and preschool visits, we all talk about the dangers of accidental ingestion, including household chemicals. We managed to put mandatory child safety locks on Tide Pods after just 2 children died. So why does firearm screening and firearm safety counseling happen so infrequently, and why have we made so little progress on firearm safe storage? One of the biggest challenges is getting a handle on firearm violence in the United States is the sheer magnitude of this public health crisis. This is not so surprising when you consider that there are 20% more firearms in the United States than people. New firearm ownership has risen dramatically since the pandemic. 2020 and 2021 set unprecedented records for firearm sales, with over 38 million firearms sold in the United States. 17 million new owners now live in a home with firearm. This is a critical statistic because it puts firearms in the hands of people who may not be as familiar with their safe use. It is estimated that there are upwards of 4.6 million children living in homes with loaded and unlocked firearms. And contrary to what most parents believe, 75% of first and second graders know where those firearms are kept in their homes and can easily access them. When surveyed, 72% of parents believe their school-aged children can tell the difference between a toy gun and a real one and will know not to touch it. But Just Say No campaigns teaching children not to touch firearms and to report the presence of an unlocked and loaded firearm have been woefully unsuccessful. Children are curious by nature, and telling them they shouldn't touch just makes it all the more enticing. Developmentally, teens are uniquely at risk for firearm injury and death. Teens are impulsive, and their risk of injury and death due to firearms can change in an instant. Research indicates that simply having a firearm in the home of an adolescent results in a 3-fold greater risk of homicide and a 5-fold greater risk of suicide. More than half of teens living in a home with a firearm report being able to access that firearm in less than 1 hour. 1/3 of those reported access in less than 5 minutes. A significant portion of parents of these teens, approximately 30%, were aware that their teens had access and did nothing to address it, perhaps believing that their teen knew better than to access the firearm. The Youth Risk Behavior Survey suggests that more than 1 in 6 high school students has seriously considered suicide in the past year, and that over half of their parents are unaware of their suicidal thoughts. This unsupervised firearm access becomes a highly concerning statistic. Adolescence is a time to learn from mistakes, but those involving firearms are often fatal, providing no second chances. And over 85% of suicides via firearm are successful on the first attempt. There's not a consensus on the best way to start these conversations, which is probably why so few providers are having them. Studies have looked at safe storage counseling and its effectiveness and have produced hugely variable results. There's no one format that's been proven to be more effective than others. Testing is still ongoing, and it seems likely that that various strategies may have different efficacy with different populations. Whatever method you choose, consistency is key. Families have made it abundantly clear that they do not want to feel like they're being singled out or judged regarding firearm ownership or non-ownership. They do not want to be counseled simply because they're Black or because of where they live. Many different professional organizations have taken a stab at creating safe storage campaigns and materials that destigmatize and normalize these conversations. Find one that feels right for your practice. Get training. Nothing is more off-putting than having someone try to provide you with education and they clearly haven't taken the time to learn about it themselves. Learn about the safety devices and how they work. Be prepared to discuss the pros and cons of each device. I'm not saying you need to go to the firing range and become an expert marksman, but I am saying you should understand the basic mechanics behind the devices that you're trying to promote. Be conversational. There are many free online courses on firearm safety with informational handouts and training videos. Many local law enforcement offices have free cable lock distribution sites and would be happy to review basic firearm safety with you or your office. Be intentional with your language. Avoid inflammatory language. Even the word gun carries with it a very negative charge, which is why firearm is the preferred term. It sounds more clinical and is less polarizing. Also, secure storage is preferred over firearm safety. Firearm safety implies safe handling, and many owners can be offended by the implication that they don't know how to handle their firearm. Secure storage and prevention of unauthorized access are much clearer. Be open, acknowledging that norms and preferences for staging or storage of firearms vary according to use. For example, a personal defense weapon is often stored locked but loaded and quickly accessible, and this is something we are highly unlikely to be able to change in a single conversation. There are many different types of secure storage. Encourage the family to find one that might work for them. Understand the laws in your state. Familiarize yourself with the firearm laws in your state, especially those surrounding child safety and prevention of unauthorized access. Every state is different, and the laws are constantly changing, and it can be a full-time job just trying to keep tabs on what's going on legislatively. Thankfully, organizations like Giffords Law Center to Prevent Gun Violence and Everytown for Gun Safety, among many others, have a full staff who do just that so that you can quickly access the most important laws in your state right from their website. Practice mindfulness. Be present in the moment. Be clear about your intentions and the goals of the conversation. Recognize the risks. Think about what you're asking, who you're asking, and why you're asking before you ask. This moment of preparation can prevent bias from seeping into your conversation. Be systematic. Develop a process. It's often good to have a script. If you start by saying that you ask everyone these same questions about safety, then ask everyone these same questions about safety. Show empathy and keep your composure if people don't react the way you intend. Consider why they may be reacting that way, what different experiences they may have had, what biases they may carry. Be respectful of different opinions, but keep the focus on safety and their child's protection. The vast majority of parents, including those who own firearms, feel it's not only acceptable, but appropriate to have conversations about safe storage with their pediatric provider. Children and teens are impulsive and unpredictable. As pediatric experts, we know that risk can change in an instant, so intervention must be constant and aimed at both the object and the person. Universal screening for firearm access and training on safe storage at every pediatric encounter is still the best defense we have against unanticipated firearm violence. Education for parents and patients on recognizing the warning signs of self-harm and harming others can make us better at anticipating violence, and access to better mental health care offers us opportunities to intervene when violence is anticipated or even before. The Bipartisan Safer Communities Act offers us some steps forward on the legislative front in limiting access for those who are a known threat, but there is still much work to be done on the state level to bring states closer together. But there will always be circumstances which could not have been anticipated. If there is ready access to a loaded and unlocked weapon in the home, we know that there is a 3-fold greater risk of homicide and a 5-fold greater risk of suicide for the children in that home. That means that 4.6 million children in the United States are currently living with a 3 to 5 times greater risk of injury or death by firearm, and that level of risk is simply unacceptable. In order to continue to move forward on this complex and controversial issue, we need to advocate for true partnerships between those who are experts in firearms and those who are experts in health, so that we can stop pointing fingers and work toward a safer future for all of us. If there are any questions, please feel free to drop them in the chat. I'll be happy to answer them as best I can. You can also connect with me after the presentation through the NAPNAP member open forum and the Pediatric Emergency Care SIG discussion board. All right, let me see if there's any questions or comments in the chat. Okay, well, I thank you very much for connecting with me tonight on this very important public health issue, and I look forward to the opportunity to meet again in another forum. Like I said, you can also connect with me after this presentation through the NAPNAP member open forum and the Pediatric Emergency Care SIG discussion board. I thank you for your time. Have a good evening.